The patient is placed in a supine position. Traction is then applied to the legs using a hip positioner. The purpose of the traction is to widen the joint space at the operation site of the involved hip. The widening of the normal hip joint prevents movement in the patient. The involved hip is placed in abduction at 25 degrees and slight flexion in order to relax the hip joint. A neutral position is essential for precise portal placement. A heavily padded perineal post is then positioned to prevent side effects of the traction force. A handle is equipped on the operative side of the leg to facilitate obtainment of the posterior view of the acetabulum by allowing adjustment of the hip flexion and aiding the traction off process. Traction can safely be carried out under C-arm monitoring. The extent of hip joint widening should carefully be monitored under the C-arm during the traction process. After sterile draping, an anterolateral portal is placed at the anterior aspect of the greater trochanter using a spinal needle. Precautions should be taken to prevent femoral head cartilage injury and labral tear. The placement of the spinal needle in the joint space is confirmed by a C-arm by injecting air into the joint space using a syringe. A guide wire is inserted through the spinal needle into the joint space and the needle is removed. A cannula is placed over the wire into the joint space after the removal of the needle. The cannula should carefully be inserted in a rotating motion because the hip joint is very tight.